Services for the month of July. And Chair will entertain a motion to approve today's agenda.
So moved.
I hear a motion by Snell and support from the other side of the room. All those in, any amendments or adjustments? All those in favor, please say aye. Aye. Any opposed? Thank you. We are now to public comment. Is there any public comment for the Human Services Committee? Any public comment for Human Services? Hearing none, we will close public comment. Move on to committee items. First item is item 4A, minutes from last month's meeting. Chair will entertain a motion. Commissioner Snell and Commissioner Bear supports. Any amendments, any adjustments, any comments? All those in favor will please say aye. Aye. Any opposed? Thank you. We are up to the Lifeways monthly report. I see Director Leonard here. Mary Beth, good to see you.
Good afternoon, Commissioners. So you'll see in your packet this month's report. It is a short report, but I do want to update you on a couple of things that are happening at Lifeways. Probably the most important thing is around, and you'll see this in your packet, around the crisis services that are being provided, the work that's being done in the community around training of law enforcement and partnering with law enforcement. We're really excited about the opportunity that we have with our local city police as well as the Sheriff's Department around providing crisis intervention training and being able to look at a co-response model down the road in which we would partner around responding to individuals in the community with a mental health crisis. It is the national trend for best practice for how you provide behavioral health services, and so we're excited about that. And they went through the training in July. It was a team training with our staff, our crisis staff, as well as with law enforcement. So kind of stay tuned as we continue to move that forward. The other thing that's happening at a statewide level is around the crisis services. We've talked many times about the challenges for crisis services for children and adults across Michigan, and there's a lot of work that's being done at a statewide level and at a local level to really impact and improve on crisis services. So the state of Michigan will be implementing, and right now they're piloting what's called MyCal, Michigan Crisis Access Line, and they're piloting in Oakland County in the UP. And what they'll be doing after that is they will be, by October of 2022, it will be a statewide crisis line, and then they will connect with the local community mental health system. So there'll be one number, it'll be similar to like a 911 number in which you call, and then they will connect you. Now the MyCal, the other important thing about the MyCal, and you'll see reference to it in this document as well, is that they will then connect them as well with crisis stabilization services. So as you know, I've shared the fact that Lifeways has been implemented crisis stabilization services both for adults and children. We are entering our second year of those services for both adults and children. Just to kind of give you some context of the number, on a monthly basis, we provide for adults 96 mobile responses out into the community that we get called about. It could be law enforcement that calls us, it could be a family member, it could be an individual themselves or a case manager. Sometimes it's a school. We've provided for children about 40 per month where we respond out into the community. And then we also provide on a monthly basis an average of 172 responses to our local emergency department for individuals that they feel need to be screened for inpatient. So there's a lot of work that's being done. We are also at the point where we had to jump a few hurdles through the state for a license for our crisis residential unit, but they will be on site tomorrow for the license inspection. I'm really hoping that we are well prepared for us to be able to get that license and be able to start providing crisis residential on site where individuals can stay up to 14 days. So it's pretty exciting. The other thing that I wanted to, that kind of ties into all of this crisis work is the fact that Michigan is also, for a long time, has been working on what's called a bed registry, in which there will be a centralized database in the state of Michigan where individuals, community mental health, hospital systems, will be able to look to see where are the available beds in Michigan. Part of the challenge when we talk about individuals sitting in our emergency department and being there often, and you might get calls or complaints in regards to that, is that as a community mental health agency who's responsible for finding the placements, right now it is a phone call to every single inpatient psychiatric facility to find out if there is a bed available. And often those phone calls, you leave a message, you wait for somebody to come back, so you can just anticipate the administrative burden that is on the system currently. There's not a centralized way to be able to look into a database and say, in the state of Michigan, I have a child that's this age with this need, where is there a bed available? So right now, the state is going to be putting into play and piloting what's called MyCare, which will be a centralized bed registry, which will make huge improvements for access to timely care. So that's exciting. The other update that I wanted to present was around the Lifeways building. So as you know, we're in the last phase of our renovations, and we are anticipating to be done about 2 to 3 weeks later than initially, and that is a lot due to workforce challenges with the subs that are on site. So we had initially anticipated being done about the first week of September. It is looking more like the end of September that we will be completed. But wanted to give you an update on that. And then the last thing is, you might have heard, there has been some local media around it, is that there is, and I've presented here long enough that you know over the years that there's always a desire to really evaluate the mental health system, the public mental health system, and to look at opportunities to potentially privatize the system. And so currently there are 2 bills, both on the House and the Senate, both very different, that are looking at changing the current structure as it is relative to the public mental health system. Really, they are around trying to address, and I do believe that that is the intent, is to address the issues that I talked about today. The fact that there are challenges with access to care, and that these proposals, they believe, will address those issues. There are concerns from a community mental health perspective relative to those 2 proposals, but I also believe as a local community mental health, we have worked hard as an agency to align ourselves in the event that they privatize the system. So with that, I will leave it up to any questions of any of the commissioners.
Questions from members of the committee? Not seeing any questions.
Wow.
Thanks, Mary Beth, for being here
Okay.
today.
All right. Well, thank you.
I'm sorry, Commissioner Bear looks like he has a question.
Yep.
Good afternoon. The bill that's being proposed and the language you're putting into it, are you in agreement with it?
No.
Okay.
No.
All right. I guess
I just worry, if I could just, the reason why I'm concerned about it is just the impact that it will potentially have on the very chronic, costly individuals that we serve in our system. I worry about what the impact on them. That's the concern that I have.
Okay. Have your agency given feedback to the people supporting this bill?
What was it? I'm sorry.
The persons that are proposing this change in legislation, this new
Yes.
legislation, have you and your agency given them your input?
Yes, we have. We have provided that input. And I have requested a personal meeting with the a sponsor of that bill as well.
Have they agreed to meet with you yet?
Not yet, but they have indicated that they would meet with me. Their office has, so I will provide that. Their office has met with me, but it's not the same as I wanted to meet with that individual personally.
All right, thank you.
Yes.
Further comments by commissioners? Okay. Thanks, Mary Beth.
Yeah,
Appreciate the
thank you.
time.
Thank you.
Next item on the agenda is the Veterans Affairs Report, and thanks for being here today. Happy July.
Good afternoon, Commissioners. Phil McCaskey, the County VSO. I have a verbal semi-annual report. Of course, 2020 includes 2020 because there wasn't a lot going on. A lot of our stuff was through fax, email. But the report is being given as an overview for 2020 and the first 6 months of 2021. In our office, we've served 225 clients during this time frame, 140 of those appointments being service-connected claims and pension benefits. 40 of the appointments were for cemetery headstones, grave markers, and et cetera, just the miscellaneous stuff that we deal with. The office is currently accepting appointments for benefit questions and applications either by phone or in person. During COVID, we continued to operate the office mainly by phone, email, utilizing the fax and email sources to acquire veteran signatures that are needed to make these applications. The American Legion has really stepped up to our office this year. We allowed them space to come in and do their service work. Upon how we were doing this, I requested from Director Easterling some extra times to be given to us, and they so graciously had people come in our office. So it helped with the phone traffic, it helped with the claim work. So the American Legion really helped out with our office this year. We've been fielding as many calls for veterans seeking help with financial needs, and these veterans, we refer them to the Michigan Trust Fund in Lansing through the Michigan Department of Veterans Affairs. They have a trust fund that a veteran can make the application. They do all the screening, they do all the qualifications, because we don't have relief funds in Jackson because we're a general fund expenditure, so we don't have this, what they call the Soldier Sailor Relief Fund. So that's our source. I do have a few nonprofits that I deal with that do charity rides that go out and raise money, and I can call on them for certain needs, and it helps out. There's guys that just won't qualify that we can help out with them there. We also work with the Community Action Agency for housing, their veteran housing navigator to seek help housing for veterans who find themselves displaced or homeless. They are responsible for overseeing the VA's SVF grants and the HUD-VASH vouchers that the VA puts out for the relief funds. So they do all the screening, qualifying, and all that. We just refer them over to them. And in retrospect, when they do get someone there that thinks they could utilize our services, it's a refer back to us. So it's a very good relationship. They service between 35 and 40 veterans, homeless veterans. Now, the term homeless veterans depends on who considers who homeless. The veteran's homeless. If your VA describes a veteran, they have to either be living on the street or be in a mission for less than 30 days to be considered homeless. If they're couch surfing on their brother's couch this week and sister's couch next week or whatever, they are not considered homeless by VA standards. So it's a delicate puppy, and that's where Community Action Agency really is a huge tool for us, because their qualifications are a lot more laxed. And they average about 35 to 40 veterans every year that they help with between the shelter and the missions. And it's sad that that's how the VA looks at a homeless veteran, because you could be very dire, but if you're not living on the street, they just changed what a homeless veteran was. That's how they got their numbers down. And it's terrible to think that, but that's the truth. On a brighter note, the office distributed over 24,000 grave marker flags this year for Memorial Day. Thanks to the county and its commissioners, this is a huge benefit that I know of no other county that does that. This comes out of the budgeted funds through my office, and these flags are placed by the different organizations around the county. And I know the neighboring counties don't do it. Actually, I have cemeteries from Hillsdale that call me and ask me if I can help get them flags. Sure, we'll sell them to you. So, I mean, that's a huge benefit. And I want to thank each one of the commissioners, because without that being in our funded allotment, that's huge to the veteran community, and it's much appreciated. And also, due to retirement of Sherry Sawyer as the administrative clerk, Sherry filled that position for 16-plus years, and her knowledge and devotion will be hard to replace, and that position's role in the daily operation of our office is a huge piece of what the office and its effectiveness. So we are in the process right now of working with HR to rewrite the job description a little bit, because everything's changed. Over 16 years, she's been in that seat, and the knowledge she's had is huge, but the qualifications for what she does through the Veterans Affairs Agency in Lansing, you now have to be you have to have an accreditation from a service organization, so we'll have to get that person accredited, plus they have to do all the interviewing for county burials by state mandate, so that person she has to be a notary, so it's huge, and these are things that just evolved over time, but she filled the position, and you don't really realize what someone does till they don't do it, and they're not there to do it. So we're going to rewrite the job description a little bit so it fine-tunes it to benefits and works for the office, because it takes the right person sitting there. When you're dealing with a widowed spouse, someone's lost their spouse of 30 years, 40 years, there's tears shed, and that's a tough spot to fill. So we're looking at getting the job description rewrote a little bit so it fine-tunes it for the office. And a couple of highlights that happened here just at the first of the year. The VA has added 3 new Agent Orange presumptions to the presumptive list of Agent Orange diseases. Bladder cancer is now added, along with Parkinson'sism and hypothyroidism. So veterans who have, in the past, we probably have about, that I know of personally, 30-some veterans that we've had on a list that if they ever passed it, well, the VA just sent the letters out. So they've initiated new claims, and the way it looks, they're going to run it under what we call the NEMA law. Some of these veterans are going to go back as far back as the date they filed the claim. That's what we're anticipating. So it's kind of weird how they did it. This is the first time in the history of the VA that the Secretary of the VA didn't introduce these as being added. Congress added them without the VA's knowledge. So now the VA they're still writing the law. So it's that's why we've been held up since January, but they're starting to move forward. So that's going to be huge, because there are some veterans, I know one in particular, 1985. If his bladder cancer goes back to 1985, that's a $3,000 a month benefit that he may be entitled to. So it's going to be big. And they also changed the pension laws again. Now we have wartime pension through the VA is a wartime benefit. You have to serve during a period of war. Well, from 1955 to the end of the Korean War to the beginning of the Vietnam War in 1964, those veterans were peacetime. They weren't eligible for any of those pension benefits, needs-based. Now they are. They're counting everyone that served at the beginning of Korea to the end of Vietnam in 1975 as a wartime veteran. That's going to be huge for some of our surviving spouses that are currently in assisted living, so it's really going to change the dynamic. There's a lot more people that are going to be qualified for these benefits. So with that ends my report. I'd open up to any questions.
Questions or comments from committee members? Commissioner Snell.
You had a number there of people that you guys have met with, veterans. So my question was, what are your outcomes on that? Yeah, we've met them, but what are the outcomes?
Well, when a veteran comes in our office, the outcome would be we're either going to write a claim a service-connected claim for them, or a possible needs-based pension. A lot of those are maybe just applications for, see if they qualify for the VA healthcare. Some are just looking for any benefits that may be available to them. And our job as the VSOs are to explain to them the benefits, walk them through them, see if they qualify. We're not the judge or execution of benefits, but if they're fraudulently, if we know it's frivolous, we don't file frivolous claims. But if a veteran wants to file a claim, we do that on their behalf.
Are you keeping
We don't, because of the fact that we pretty much, if you walk in the office looking for information or looking for services, you're going to get your services. But to track them, because once a claim is filed, we have if a veteran never comes back, you file a claim and they get a benefit, we don't get notification from the VA because we're helping them advance their claim as a liaison. We don't, because of HIPAA. They don't ever notify us. VA doesn't say, hey, we got 14 claims that were approved and this is how much. Until the veteran comes back, hey, thank you, that'd be the only way we would be able to track what the positivity is. Yes, sir.
I can say that, when I've had people that wanted to get benefits or were confused on whether they have anything coming, you can testify more than anyone else how confusing and complex it can be, especially to those who are not experts in the field as you are. I've always had great responses and replies from constituents of the good service they've gotten from your office. So thanks for that.
Thank you. Yeah, our office is one of the reasons when Dave Lelahan was here, and I worked in that office for 12 years as the American Legion service rep that came in every week. It was a no-brainer when he asked me to apply because of the fact that the office is very well respected around the state of Michigan. When it comes to counties that don't have veteran service offices or are starting them up, I field a lot of calls from other counties, Hillsdale in particularly. I mean, sometimes I feel like I'm her information source, but it's nice to be able to do that because it's in Lenawee County is the same way. We have a great relationship with them, and it's huge to have the knowledge. I mean, I don't know it all, but I guarantee I can get a question for everything.
And the follow-up that Commissioner Snell mentioned is a good point. Sometimes you don't hear from folks who have gotten what they want, but sometimes you also don't hear from folks who have kind of given up and gotten frustrated and decided not to move forward. So it's
well, I'll tell you, the success stories are the ones who walked into the VA in 1975, got out of the service, out of the Vietnam, and were spit on and cussed at. When I went to the VA was not a friendly place in the 70s. Over the years, because the Vietnam veteran got involved with legislation and sat in those seats, the changes have been made. The VA is it's different. When I hear a guy says, I'll never go back, go try it once. Go in there and try it, be open-minded, and you'll come back and you always get that. You were right. It's different. They want to help me. And that's huge because that's worth $1 million to me, because when someone calls you back, and then the referral, we do a lot of referrals. We have people from outside the county that, hey, can you help my buddy that lives in Ingham? No, but I can tell you where you can go to get it. We're busy, and I can't take those people. I'd love to, because I want to help them all. But yeah, it's very rewarding, and I do appreciate you guys letting us have this office in the county.
We appreciate the work. Thank you. Any further comments by commissioners? Thank you for the work, and carry on.
Thank you.
And now, the Department on Aging. Hi, Danielle. How are you? You're bringing a box.
One of the first items that I had to take care of today, and good morning, actually good afternoon, apologize, is the Senior Citizen of the Year resolution. And our advisory council met in June, and they had 4 individuals that were submitted to look at for the Citizen of the Year. And they found one person that really stood out based on the person's letter of their years of service for volunteering in the community. So we wanted to recognize John Conley and recognize him at the fair on Monday, August 9th. And so what I was looking for is to see about a motion to take that to the full board for the resolution.
Questions or comments, or the chair will entertain a motion to adopt the resolution recommended for the full board?
No question, I'll offer motion.
Thank you. And is there support? Thank you, Commissioner Williams. And is there a question? Is there a question? Okay. Any questions? Ready to act on the motion? All in favor will say aye. Aye. Any opposed? Thank you, and congratulations to Mr. Conley.
And I can go further along with my report. And learning about Mr. Conley, I was able to go ahead and talk to Disability Connections, where he has volunteered over 4,000 hours in the past 13 years. He mainly works in their loan closet, so they take in equipment like walkers or wheelchairs or any kind of adaptive equipment like that, and then they distribute that back out into the community for people in need. So he works to clean the equipment. If something's broken, he repairs it. He spends a lot of time helping to make sure that that loan closet is available for those that are in need. When I talked to the Lady of Fatima regarding his work with the Knights of Columbus, they made some very good comments. He never misses a meeting. He's always the first to volunteer for anything that they're doing. He's really a true advocate for those that are in need. He's a valuable member in the community. He also helps with the blood drive, so there was a lot of positive things in reaching out to the individuals and talking to them personally. So we're very thankful that we're able to recognize him, and I'm going to be glad to meet him on the day of the fair. One of the other things that I noted in our report is that we received some funding from an elder abuse grant. It's like a little mini grant. And when we wrote the grant, we weren't sure where we were going to be yet with the pandemic. Sometimes in the past we've done like a luncheon and had some speakers come in. We weren't sure at the time where we'd be at with capacity and what might be allowed. And we've always kind of wanted to offer a shred day for our seniors in the community as a way to really kind of protect your information, how to properly dispose of that. And so Region 2 awarded us, it's about $750 so that we can go ahead and offer this shred day. So we're going to do that on September 17th. It'll be for like a 2-hour period. I wondered if it should be longer, but they said really 2 hours really kind of keeps it focused. During that time, we're going to go ahead and have informational booths out about elder abuse, frauds and scams. You know, we'll have our Department on Aging display to kind of highlight the services and programs that we offer. But it'll kind of be like a drive-through where people can, we'll help them get their boxes to the location to get them disposed of. They can go ahead and check out our resource booths. Region 2, with that, they had gotten a donation of these kind of like security boxes, so we have about 40 of these to hand out in the community I'm thinking like one per household is what I'm thinking, but somebody could store their medications or something they want to keep private and just put it somewhere safe in their home. But I also wanted just to show you, we have a lot of elder abuse brochures that we have collected we mainly got last year through the elder abuse funding. Last year we weren't able to do an event, but we have a lot of these available. The post office has great information, and you can get a lot of brochures from their office about different scams and, of course, phone and mail scams. And we also have a lot of these on preventing crime and protecting yourself. again, that information and education that we want to provide during that event. And that is always so important. I always come here and kind of talk about different situations where somebody's reached out to us. And on our recent senior circuit, we were highlighting like dating scams. And we had a senior, she actually called me and wondered about whether she was being part of a scam. You know, the scenario of somebody being on a ship and being a professional but not able to access their funds, and just all the information that goes into that, and just trying to talk to her and saying, yes, it sounds like a scam, it is a scam. You know, so just making those one-on-one contacts as much as we can with individuals in our community to educate them. And so I'm really hopeful that we'll have a great turnout with that Shred Day, and again, make those connections. So that's really what I have for this report. Is there any questions?
Questions for Danielle? I think I'm going to draw Commissioner's attention to the Senior Day Award that's in your report, August 9th at 11 a.m. That's our committee day, but maybe if we get a chance to jump down to the fairgrounds and be there, I'll try to do that. So commissioners, just be aware. Something fun to do, and the seniors pay attention to who's there.
Yeah, and our line dancers are excited. They get to perform along there too, so.
Line dancing. Okay. Anything else? Thank you.
All right,
Appreciate
thank
it,
you.
Danielle.
Sorry.
Thanks for the work. And now the Health Department, and I think that's Deborah.
Yes, thank you. There's a report in board docs for review with many highlights. The WIC program, of course, is up and running. They are transitioning to in-person. They have different guidelines through the federal government, different deadlines that they have to meet with regard to in-person meetings. So we're working with that. There's many programs that are up and running for the summer. So they're busy over there. And environmental health did include some additional information. There was some questions last month with regard to their process of the food establishment plan review as well as inspections. So there's additional information in there from environmental health, and Don is here in case there's any questions on that. Regarding COVID, things have been slowing down with regards to COVID. We in Jackson County have a 1.6% positivity with tests for COVID tests that are given. Statewide, there's 62.2% of individuals have received a first dose of a vaccine. Our daily numbers are in the single digits, generally under 10, of course. This past weekend, because we're combining, as things slow down, we're combining numbers over the course of a weekend. We had 9 as of Friday, 9 new cases. The immunization clinic is working with return to school plans. We've been working with some of the school districts with regard to masks or no masks and what kind of plans, COVID plans they will have for the fall once school starts back up, because we are in the middle of July and that is around the corner. It's going to be here before you know it. So we are already working with the schools as far as guidelines and how to safely start school back up. And they will be at the fair. We'll be at the fair for COVID vaccines. They're going to be there. I know they said on, I think Monday is Leonard Skinnard. I think that's what day they said they're going to be there, but we're going to look at other options as well. So we are out and about. They're still doing some vaccines here and there. And like I said, working with the schools to safely restart the schools in the fall. Any questions?
Questions from commissioners? Commissioner Bear, please.
On the number of cases, you said there were 9 cases this past week?
Weekend. Yep.
Weekend?
Oh, since Friday.
What's the current definition of a case?
A person who tests positive over that day. So we've combined the weekend, so it would be since Friday's cases, so Saturday, Sunday.
Okay. So a case is just somebody that tested positive, whether they're totally asymptomatic or if they're ill. Correct. All right. So, yeah, I've asked this before, and that's a totally different definition for a case than what used to be used 2 years ago. 2 years ago, a case was a person that was sick and needing medical intervention. Now it just means somebody that tested positive and they may or may not need medical intervention. All right, second question on WIC. What kind of identification does somebody have to present to be able to enroll themselves, their family in WIC?
I don't know the specific guidelines, but they do have to meet program requirements set up by the federal government. So they do have to meet an age. It's for children up to age 5. I don't know specifically what they ask for as far as ID, but I do know that there are income requirements that they have to meet, and it is all dictated by the federal government, because it's a federal program.
All right, by our board meeting, can you check that out? Let me know what identification they are required to submit to sign up? Thank you.
Further questions for the Health Department from commissioners? Thanks, Deb, and to your crew out there for the hard work.
Thank you.
I see in the report that there's that there are graphics of the percentage of those who have been vaccinated, whether it's over 16 or it's over 65. I would draw the attention of commissioners to those graphics where some areas are more vaccinated than others. And Deb, you have a budget amendment to suggest to us?
Yes, we do. The Health Department received money from the state and federal government with regards to COVID monies, and Jonathan is here, our senior accountant that handles all of the finances at the Health Department. But basically what he explained to me is that we're moving all of our grant money that we received, and by grant money, we didn't apply for most of this. I think Jonathan can correct me, but we didn't apply for it. It's just CARES Act and ARPA money that was given to the health departments throughout the course of COVID. We are in line to receive some as well for 2022. Keep in mind the health department budget goes from October 1st to September 30th, so they're a little bit different financial year. But we're moving this money that we received, which is about 1.8 million and some change, into the revenue and therefore distributing it. So Jonathan, do you have any further explanation or?
Yeah, well, what I was going to say at the beginning of the year, we had some CARES Act funding that was coming through that we weren't able to determine what the amount was because it was running from, say, March through December. And so we didn't know what the carryover was going to be, so we didn't really have an amount that we could really budget at the time of creating the budget. And then obviously, once the COVID vaccine was introduced, then we received some additional grant funding to pay for the cost of the vaccination programs. And so that came after the beginning of the year. So all of these grants really were kind of unknown. They were unknown at the time we were creating the budget, and that's the reason we're having to present the budget amendment at this time. The other one was the health and nutrition grant, which is not an automatic renewal, and we didn't know what the status was. So those are the two main things. Other than that, it's just primarily shifting some funds from one place to another based on a lot of the programs. Actually, it's actually been pretty good because a lot of them we didn't know because of reduced activity due to the COVID response. So it's kind of been a pretty fluid situation. But in some cases there was more activity or less activity based on COVID response, and so that's pretty much the balance of it.
I will also note that we're going to be in a similar scenario for the 2022 budget. We've been notified that we're going to be receiving, additional money through ARPA and the state of Michigan, but we have not been advised on how much that's going to be, so we will be in a similar scenario for 2022 as well.
Is it fair to say that that this grant is relieving us of some funds that we would normally pay through general fund? Or is that too simplistic a statement?
No, you're correct in saying that. Because of the fact that with the COVID grant money, so some of the program people have been diverted from other programs that may have been required local contribution for those grants. And by diverting them into the COVID response, in most cases, 100% of their salaries and wages are covered by the grant. So yes, it has reduced the local contribution.
Additional questions? And if not, the chair would entertain a motion. Commissioner Snell moves. Commissioner Bear supports the motion to forward this budget amendment to the full board with a recommendation for approval. Any further comments? All in favor, please say aye. Aye. Any opposed? Thank you.
Thank you, Commissioners.
And are you finished now, Deb?
Yes, sir, thank you.
Okay, thank you. Chair will entertain a motion to pay the claims. Commissioner Mahoney moves, Commissioner Williams supports. Any discussion? All in favor will please say aye. Aye. Any opposed? Thank you. I don't see any other minutes in item 5B. Please take note of the reporting schedule for August, the Department on Aging, the Health Department, and Lifeways. I would also make note here that I'm working with leadership and management on a meeting to be held at some point in the future to discuss in more specificity the situations regarding housing in the county and where we stand, and but that'll be sometime in the fall. The chair will now entertain comments from committee members. Any comments from committee members? Hearing none. I beg your pardon, I walked right over public comment. Thank you, Madam Clerk. Any public comment? Any public comment? Thank you, no? Okay. We will now adjourn until next month. Thank you, members.